I'm John DeMont, a columnist for the SaltWire Network. Now, we hear lots of ugly stories about the state of the healthcare system these days, but there are good stories too. There are bright lights. One of them is virtual care. And Norm Pinsky, a family doctor in Hubley, Nova Scotia, is part of that solution. Thanks for joining us today, Norm.
You're so welcome. Thank you for having me.
So you are new to virtual care, but you are not in any way new to doctoring. This isn't your first rodeo.
Correct. Well, I've been a family doctor for 40 years, and during the pandemic, I retired, not because I wanted to, but I didn't want to bring home anything to my family, my wife, my son, who's a medical student. And for about a year, I didn't work, and then I saw a small advertisement asking for doctors to come out of retirement and do virtual care. And I thought, this is it. Not only would this be great for me, but this is what people need. And virtual care has made a huge difference. There's no doubt that we need to work on the medical system in Nova Scotia and Canada, but this is making such a big difference in people's lives, making it so easy for them to access healthcare. And I'm so happy to be part of it.
Well, that's wonderful. Tell us, if you would, how virtual care works. I mean, virtual, and it is virtual, and there is care. But beyond that, I think the average person, isn't quite sure what happens. So if I enter the virtual care system and I contact you or I am put in touch with you, how would it work?
Well, the main thing is that this is for people on the list who do not have family doctors. Their doctors have retired during the pandemic or died or moved. There's a lot of people who've moved into the province. There's a lot of immigrants who've moved into the province, and they don't have family doctors. These are people who feel abandoned by their doctors and neglected by a system, and justifiably so. They've waited for hours at walk-in clinics to get prescription refills, sometimes only to be told there are no more spaces left. Then they have to go to an emergency department and wait hours, many hours, taking up space with people whom they know have COVID around them, just to get a prescription to continue their medication. And now they can put in a request. They can get a same-day request from the comfort of their home. They don't have to drive. They don't have to get childcare. They don't have to ask their boss for time off work to go see the doctor. And they get to see someone like me or many of the other doctors. And they'll say, I just need my prescription, doctor. And I'll say, for your blood pressure? And they'll say, yes. So I'll say, and what is your blood pressure? And I'll tell them how to take their blood pressure properly. I'll tell them what their target average should be. I'll ask them, how long has it been since you've had your cholesterol checked, your blood sugar, your PSA, your pap smear? And I'll send them to diabetic clinics, to women's clinics, to in-person clinics, and I'll send them for blood tests. And we'll both get the results. The patient gets them and the doctor gets them. And I always call people with their results. I explain the results to them. They get some continuity of care. And you can just see on their faces that they're so grateful. Wow. And it's so gratifying. And
it sounds, Norm, not unlike what you would be doing when you were practicing as a GP in many ways.
Of course, it's still medicine, and sometimes it's more challenging because you're not able to do a physical assessment. So you have to learn techniques on asking people, well, here, do this test and tell me what's happening. But I mean, we concentrate on history a lot, and of course we can send them for tests if we need to. But the main thing is that people don't have to wait, and they can access care from the comfort of their home. And
Yeah.
And this is a big step in
Yeah.
healthcare in Nova Scotia. And
It sounds, are you hearing any sort of really egregious stories of people, having to wait huge amounts of time, or just, haven't seen a family doc in, well, perhaps you talk a lot, you speak about new Canadians, probably they've never seen it, some of them have never seen a Canadian family doc.
True. And even people here, it's been years since they've seen a doctor.
Yeah.
And sometimes some places like Yarmouth don't even have walk-in clinics. So their only option is to go to an emergency department. Yeah. And they just feel like they're in danger there.
Yeah.
They're waiting for hours, 10 hours, 12 hours, 14 hours, and then many of them leave without even seeing someone. And it's not up to an emergency room physician to say, oh, let's do all your risk factors for cardiovascular disease and stroke. This is a family medicine issue, and so it's up to us to fill in that gap.
You would have clients, or you would have patients from all around the province, I guess. There isn't sort of a geographic, restriction to the kind of people that you would, where they live and that sort of thing.
Everybody has to be in Nova Scotia.
Yeah.
And all the doctors are in Nova Scotia.
Yeah. Yeah. And just give us a sense, you talked about filling prescriptions and talking in a general way about, sort of blood pressure and things like that. Just give us a sense of the range of things that you've been able to help people along with, as in your new role there.
Everything. I've been working for a little over 2 months. I've seen almost 700 people. I've diagnosed new cancers. I've diagnosed new diabetes. There's a lot of mental health issues due to the pandemic, and also from people just not having access to care. There was a person I helped fill all her requirements to become a live kidney donor.
Oh, wow. Wow.
How much better could it be?
Yeah, yeah. It sounds so you spoke earlier of the how gratifying, or maybe that's not even, how grateful the patients are, when they finally get through to for when you finally treat them. I mean, that must be very gratifying for you.
It's terrific. I love clocking on every morning, and even this morning I've been on and seen over a dozen patients waiting for this interview.
Yeah.
And every visit is gratifying.
Yeah.
I love getting on every morning.
Yeah, wonderful. I wonder if it, Norm, if you're, because I know friends who are family docs and things, and I know that we all know a whole bunch of them, and there's a pressure to kind of move people along. It seems to be anyway, most sort of clinics I know of. Do you feel that you can take a bit more time in a virtual setting than you might have been able to do in a in-person setting?
Definitely. I was always on a fee-for-service basis. Yeah. There were always people waiting. So there was always pressure to work as fast as you can.
Yeah.
And now there's still the usual pressure that we put on ourselves to help as many people as we can. Yeah. But I always feel like I have all the time in the world for that one patient that I'm with, and I hope I give them that impression that that's the way it is when they're on.
Yeah. You spoke of what this does, how important this is for our healthcare system. Maybe you could just elaborate on that a little bit. I mean, these are people who are unable to see family docs, but as you point out, many times they're ending up in ERs and things like that, and the backlog and the clogging and the log jams. So for the system as a whole, this is a very positive development.
Probably over 95% of people I see do not have to be sent to a walk-in clinic or emergency or to an in-person clinic. So hundreds of people have not had to go to those places.
Yeah.
And think of how that has freed up the system, because each person who goes into Emerge sees a nurse, well, first to get registered and then to get triaged and then to see a doctor. And it just saves so much time. It frees up people who can do what they're good at, doing emergency medicine. And even if we can tell people, I don't think this is serious, I don't think you need to go to Emerge, let's try this, let's see how you do, and call us back if the problem persists or if it worsens. And that's so satisfying for them. That's good enough. That's what they want to know.
Yeah. Now you've been doing this for 40 years, and you've practiced medicine in other countries and things like that. Just your thoughts in a general way on where our system sort of finds itself right now. You know, kind of historically, and also maybe geographically, and some of the other things you've seen. I mean, you know, what's the state of things in your view?
Well, Nova Scotia is a poor province, and we don't have all the care that we need. It can definitely be more efficient, but this is a big step. This is a huge step to help things. And I hope that the government will continue it. I hope that they'll enable it for specialists.
Right.
And
that's the next step, the natural next step, is it? Specialists and that sort of thing, virtually.
Even if they had nurses and people in emergency who could be accessed, and the patient can say, do I need to come to Emerge? And the person can say, yes, you do need to come, fine. Or no, you don't need to come.
Yeah. Do you get any sense that there's any resistance to this anywhere through the system?
No, the bureaucrats.
Everybody's aligned. Yeah.
The bureaucrats at Nova Scotia Health have been very accommodating and very helpful. And I haven't always been a great proponent of Nova Scotia Health, but for this program and platform, I'm all for it.
Yeah. Can you, in a personal sense, what has this meant to you? I mean, you had retired, not for long. It didn't seem. I mean, this has given you, well, you know, what you're doing is very important, and it's what you've always done. It must be sort of a wonderful surprise in a certain way. You know, did you feel you might have, if it were not for this, that you might not be, you know, practicing to the degree that you are right now?
I wouldn't be practicing at all. I mean, I was always available to friends and families, and I even put out my telephone number in our subdivision for people to call during the pandemic, because I love practicing medicine and I love helping people. Yeah. But to do this and to prescribe and to refer and to send people to all the places that they need to go, well, this is what I've always been trained for.
Yeah. What do you think, you know, sort of in a broader sense, and this is very broad, of course, virtual care, but that we can learn from, our system can learn from the success of this program? You know, it seems flexible. It seems, as everybody likes to say, is thinking outside the box. Is it the kind of the concept that we're sort of in a broader way use? Is that work here? Can we use that in other ways, I wonder?
Well, it first needs to be continued.
Yeah.
And I think it needs to be broadened. Yeah. So if specialists could use this, it's up to Nova Scotia Health and the government and how they wish to use the money that they have.
Yeah. Can you just give us a sense, Norm, of what your day is like as a virtual care doctor? You say you got up this morning and you just, I guess this is your home office, and wandered into your home office and just logged on and just started doing your thing. It's just the equivalent of, instead of going into your clinic and your doctor's office, you go into your home office and you just get online. Is that essentially it?
Well, it's good for me also that I don't have to drive and pollute the atmosphere and worry about snow and ice and the weather. And I clock on at 9 every morning, and I'll work until 5 or however late the platform stays open. And if I see that there's people waiting, then I'll continue, because we don't want to leave people in line.
Yeah.
So it's just a full day of work, and every patient is a benefit to them and to us.
Yeah, wonderful. Good. Norma, that's great. Thank you very much. Really appreciate it. Congratulations on this, and we thank you for it. Thank you for your service, as we like to say.
A pleasure. Thank you.
I'm John DeMont for the SaltWire Network.